Hi guys, Dr. Andrew Brand. I'm a physical therapist. I want to spend a little bit of time talking about iliotibial band syndrome and just lay it out a little bit so that it's a little bit more easy to digest, right? Easy to understand so that if you do have questions about this for you or somebody you know, that you have a good foundation of where to start as far as what is exactly going on, so that you can kind of seek out the appropriate medical care, take the appropriate precautions, especially if you're a runner, you got a race coming up, or you're just trying to navigate your return to running if this is holding you back at this point. So essentially what we have here, I'll give you a little bit of anatomy overview. This structure on the side of the knee, right, it's the iliotibial band. It starts up pretty high actually, and it goes all the way up to the pelvis. The muscular component or the contractile component is actually the tensor fasciae latae, and so this smaller muscle component. So a lot of times we'll actually look at this this muscular component as well, because you can see it as a relevant contractile component and therefore influence on the iliotibial band and how it moves and behaves. So a lot of times that's where we look at to begin, and then we see how it behaves in more of a static and then a dynamic phase with a runner. So a lot of times we'll get a runner on the treadmill, break down to see how exactly this injury is influencing how they run, and then kind of factor that into our treatment. So when you do get irritation in this band, a lot of times you'll kind of feel this sharp stabbing feeling in the side of your knee. It's not a fun experience to have to go through if you're a runner, because it really does stop you in your tracks. And so a lot of times you feel it on this lateral outside of the knee. You can almost just push it, and it really just reproduces that pain, and it doesn't feel good, right? Going downstairs is usually worse than going upstairs. All those things are really, really painful when you load the knee, especially in an eccentric fashion or in a controlled lengthening fashion of the knee joint itself. And so a lot of times what we get to work with runners is we get to work with some subtle gait retraining to make some small changes to how they run to offload this structure a little bit. We work on desensitizing that iliotibial band itself to make it more tolerable, and then work on how we can basically move in a way so that we can equip muscles to detension that detension that iliotibial band, so that it doesn't become as reactive to the single leg dynamic stances and basically a series of hopping that you do as a runner, right? So it doesn't become as sensitive to that motion. So if this is something that you do have, of course, the first thing I like to advise is decreasing your running volume, so decreasing your distance, and see how that behaves, how that responds to that. If it's something where it isn't going away, a lot of times we do treat this, and it's something that is rehabbable. A lot of times you don't need surgery for this. It's not a very well handled pain or injury from a surgical standpoint, and so this is something we do get to work with quite a bit. So hopefully that gives a little bit of background on iliotibial band syndrome, sort of just give you an understanding of what's going on and better help you address it as you kind of encounter this.